Welcome to Everyday Nursing Knowledge Lectures, and today we will learn what is the difference between central and peripheral stimuli in assessing Glasgow-Coma scale. Glasgow-Coma scale is used to assess a patient level of consciousness. That means how alert and responsive a patient either to environment, that is to surroundings, or to stimuli. The stimuli can be two types: to verbal, that is to your speech, voice, etc., or to a painful stimuli. You apply pain to the patient and see patient's response. Now, when to apply a painful stimuli? You use a painful stimuli if the patient is not obeying commands and in the absence of any spontaneous movement, not even responding to verbal stimuli, then you apply painful stimuli. There are two types of painful stimuli. One is peripheral painful stimuli, second is central stimuli. In peripheral painful stimuli, you apply pain to the peripheries, that is to extremities, and you see spinal cord response. In central stimuli, you apply pain to the center of the body, and here you see brain response. You can see peripheral stimuli by assessing fingernail bud pressure, and central stimuli by three methods: trapezius squeeze, supraorbital pressure, and sternal rub. In fingernail bud pressure, you apply pain or pressure to the fingernail bud by pressing with a flat pen or pencil and see whether patient has any response. Patient may open his eyes, patient may withdraw, and you see a patient's response. But remember, this is not a brain response, this is a spinal cord response. So if a patient needs painful stimuli in assessing Glasgow-Coma scale, you have to do a central stimuli first. And you can do a central stimuli by doing a trapezius squeeze or supraorbital pressure or sternal rub. In trapezius squeeze, you are squeezing trapezius muscle. This muscle extends from back of the neck to the shoulder, and you have to squeeze by using your index and two fingers about 1 to 2 inches and see whether the patient responds. Or you can do a supraorbital pressure, that is pressure applied to the supraorbital region, that is above the eye socket but below the eyebrows and below the forehead. You apply the pressure and assess whether the patient responds. Or you can do a sternal rub, rubbing the sternum, and see the patient respond. So sternal rub, remember, always can cause bruising. And if with the central stimuli, if the patient does not respond, then you apply the fingernail bud pressure in all 4 extremities and see whether the extremities move. So today we learned about the difference between central and peripheral stimuli in assessing Glasgow-Coma scale, and thanks for watching my video.